Welcome to the Senior Living 411 series. Sometimes things happen, and our mute button was on, so now we're back and we're live. I'd like to welcome Dr. Pat Hewitt to the Senior Living series on chiropractic for seniors. And let me just tell you a little bit about Dr. Pat. Dr. Pat Hewitt grew up in the city of Mississauga, and where he went to elementary school, and then he went on to high school at Woodlands High School and graduated from there. He continued his studies at McMaster University, where he got his Bachelor of Science honors degree in life sciences, and then furthered his education at the Canadian Memorial Chiropractic College, where he achieved his Doctor of Chiropractic Degree in 1985. Over the past 35 years, he has been a licensed and practicing chiropractor. Over the last 35 years, he has seen just over 7,000 patients and has adjusted, or at least had over 350,000 client visits. Now that's a heck of a lot of adjustments. And I guess with all that practice, he must be near perfect. So I decided to bring him on where we can chat a little bit about chiropractic for seniors. So I have a few questions for you, Dr. Pat. How are you today?
Well, I'm very well now that I can hear perfectly.
Well, we just had to adjust your hearing.
Well, how are you?
I am excellent. I was thinking about some of these questions earlier, and I said to myself, well, I know that when I started in '85, I was playing ball. I was a young baseball player, and yeah, you adjusted me, but I didn't know if it would be a good thing for seniors. How is this chiropractic for seniors? Talk to me.
I think that anybody, it's a case per case basis. You know, the important thing is, if a chiropractor is the person that needs to help you, there's a good chance that nothing else you do will help. If it's a problem that's specific to chiropractic care, generally, you know, stretching and activity and other things, other kind of rehab activities that usually fix other things, when they don't help, very often it's because it's something that a chiropractor needs to attend to.
See.
With seniors in particular, they're always more challenging, because very often when a senior has a problem, it's something that's been around for a while, and it's not always an easy, quick solution. Sometimes it's you spend a lot of time asking patients to just be patient and that change will come, but it doesn't come the same speed at which it comes when you're 25 years old, or in your case, when you were 17 or 18 or whenever it was that you and I met. But certainly chiropractic has its role and its place in healthcare, regardless of people's age. The trick is to find out whether or not the thing that you're experiencing is something that is a chiropractic problem, or if it's something that's more amenable to other therapies.
All right. Well, so when it comes to seniors, what areas do you find that you're working on most of the time? Is it, you know, lower bodies?
I would say there's interesting things about people as they age. When I was younger, my patients were younger, and primarily it was, you know, low back, mid back, neck, the classic things that you would expect people to come to the chiropractor for. But as my patient base has aged with me, all of a sudden all these other common threads that aren't really part of practice when you're treating, you know, 25 and 35-year-olds, feet, knees, hips, wrists, hands, elbows, shoulders, all these peripheral joints and other things that people might not associate with chiropractic care become part of patients' regular visits, and patients who know seek me out for things that are different than the things they might have thought to seek me out for when they were 25, 35, or 40 years old. I would say that as people age, the care becomes more global. More things are involved with the patient visit, things that you wouldn't expect that I would be treating.
And I know that you've like I noticed you treated a lot of people for a long time. When you're getting a new senior, and somebody who's already in who's never seen before, I would imagine that takes a lot longer to kind of diagnose or get to that stage where they're starting to react properly.
There's a bunch of things there, with me. My patients, like I said, have been aging with me, like yourself. I'm not saying you're aging. Like yourself, most of the patients that I see have been patients for decades. And so the care is more of an ongoing part of their life, like walking or square dancing or swimming or other things that they do to just keep themselves mobile and functional. When a brand new patient comes in who's a senior, who's never had chiropractic care, and they're already 75 or 80 years old, or 70 years old even, it's very important to, as a practitioner, to make that call about whether or not intervention is going to create a timely change, or if the time and effort to make that change, the time and effort and the expense to the patient to make that change, is worth all the work that goes into it. So there's lots of problems that seniors have that are very quick to change and easy to manage. And there's other ones that are very, very complex problems that often they're minimal returns and smaller returns for big investments of time and effort and money, and diagnosing and including senior citizens into care is a lot more thoughtful process than it is when people are 25 and 30 years old. Those people, you find things and they're generally not complex problems, and so you can just enter into care and expect change to happen within 7 or 10 days, that the patient knows the process is contributing and making positive change. But with seniors, although sometimes those changes do happen that quick, other times you have to be very cautious about entering into a process with a patient where they're thinking they're going to change next Wednesday, and you're thinking they're going to change next season. And you have to make sure that you're communicating with your patients about what the expectations for change should be.
All right. Well, we answered the who and the what. What about where? Where do you find yourself doing some of the work that you do? Is it? I know you have an office. We'll put it in the chat and we'll put it on the screen. But do you do house calls? Do you do? Some of these seniors are in homes now.
For certain, I do, especially because, and I currently have my offices on the second floor of a commercial building that has no elevator. And even though it's a nice staircase, it's nice, easy rise, wide steps and everything, there are patients that I prefer just don't come there. So I have a portable table, and there are patients that I've had as patients for years and years, and I just, I finish in the morning and I grab my portable table and I go to their house, and they have an appointment at a certain time, and I arrive there and I just deliver the care at home. And I know there's lots of chiropractors and massage therapists and osteopaths out there that are providing that kind of service for seniors, because driving, parking, staircases, snow, all these other complex factors that are involved before you even get in the door of the clinic that aren't relevant when you're younger, that become more relevant as you age. It's just a service that needs to be rendered so people can have their care and then not be completely stressed out right after they get their care, driving home or whatever. So yes, I do wear at seniors' residences, residential care, long-term care, private residences. Even as I mentioned to you, I've treated patients in cottage country with my portable table on the dock, and patients that I have that are on the lake where the cottages come to get their treatments on the dock. And it's all documented and it's all their same file and everything, but where I render the treatment is hugely variant.
Oh, wow, that's excellent. I was just thinking, and I think a question came in from the audience, was what's your story? Like, how did you decide chiropractic was the way to go?
Well, when I was a kid, I was a competitive swimmer, and I was in a race at one point and misjudged. I was a backstroker and misjudged my finish. And I went to reach back to touch the wall, the way backstrokers reach back to finish. And I was about 18 inches closer to the wall than I thought I was. And I hit my arm on the side of the pool and dislocated my shoulder. And it pretty much finished my swim career. And my mom worked, she was an orthopedic nurse at the old South Peel Hospital, which became Mississauga Hospital. And, the orthopedic people told me that was it. And I didn't really swim for a while. And then my dad was seeing a chiropractor in Streetsville, one of the old school chiropractors in Streetsville, who was, trained in the early 50s. And I went there with him one time, and my dad said something about my shoulder. I talked to the doctor, and he said, "Did you hit your head?" And I said, "Yeah, I hit my head and my arm quite hard." And he said to me, "Well, let me just check something." And he put me on the table. I was sitting with my back towards him, and he was checking my shoulder. And he said, "Yeah, that shoulder's definitely had an injury and it's unstable." And then he started checking my neck, and there was something really sore in my neck. And he said that he thought that some of the problem I was having with the function and strength in my shoulder was because I had injured my neck at the same time that I injured my shoulder when I whacked my head on the pool. And with permission, he treated my neck, and it wasn't like, some magic change, but over the course of a fairly short period of time, maybe 2 or 3 weeks, I don't know, 60-70% of the function in my shoulder came back. To this day, my shoulder is not the same as it ever was, but I did go back to swimming, and I continued to swim competitively when I was in university, right back until I was 21, 22 years old. So it was that and the advice of my father, because when I was in high school and in university, I thought I might be a medical doctor, but my dad knew that I didn't deal with authority well, and he said I would be better off being in something where nobody was bossing me around. So being a dentist or being a chiropractor or being something else where there was just the one guy. He said, "I just think that would be a better thing for you to do." And to him, it was an honorable profession because he'd been seeing chiropractors since he came home from the Second World War. So that's the long version, I guess, of the answer to why.
Wow. Now I know, and now others know as well. When's the best time to treat? Some people go through different things in their lives. When's the best time to get treatment?
I would just say that, as I say to all my patients, the best thing to do is go and get examined by a chiropractor, even if you feel no reason to go. Because if your first introduction to a chiropractor is when you're in distress, the chiropractor has no idea what you're like when you're not in distress. And it becomes a very much more difficult thing. With my patients who've been bringing their kids by the clinic for years and years, and I check their kids all the time. And, most of the time you don't find anything on a child. And then if suddenly something happens, the child doesn't feel well, or the child has an accident or a fall off a bike or whatever. Now you've got, whether it's a child or an adult, if you've been seeing somebody and just checking them when they're well, then you know what they're normally like. And if something arrives for them that puts them in distress, now you know what's different. And it's much easier to focus the care and make thoughtful recommendations when you know what that patient's normal is, versus just seeing the patient when they're in distress. Because as soon as someone gets in distress, the body starts adapting. And you can say, oh, you have tight hamstrings. Well, maybe the person doesn't normally have tight hamstrings, but because their back is so sore, they have tight hamstrings. And you can make the mistake of saying, oh, your back is sore because you have tight hamstrings. Well, maybe normally your hamstrings aren't tight at all, right? And that's the protective mechanism. So I think the best time to go is when you think you shouldn't go, that you don't need to go. And I'm not saying go and get care. I'm saying go and allow the chiropractor to become familiar with what your normal is. So if you get into a distress situation, the chiropractor already knows who you are and what you're normally like.
Well, that's like, getting that assessment done before you fall. Make that one call before you fall. Make that one call to the chiropractor before the injury becomes chronic.
Yeah.
I have here a question. Why is it a good idea for seniors to see a chiropractor? I mean, I understand, there are other practices, other kinds of, you talked about becoming a doctor and for those reasons, but why would be a good idea to get an assessment here with a chiropractor over a medical, or vice versa?
I think my first and simple answer to that would be, don't look at it as an alternative. It's not an alternative. Everybody has their role to play. There's things that MDs and medicine do that nobody else can do. There's things that osteopaths do that nobody else can do. Acupuncturist, massage therapist, chiropractor, dentist, personal trainers. Everybody's got their unique role to contribute. And smart people, people who are smart enough to buy cars and houses and vote and everything. The big thing is you go and you interview your healthcare provider and see if you think they have something to offer you that's value added in your life. Maybe chiropractic isn't the thing, but maybe it is the thing that you're missing. And you don't know unless you go. It's
Right.
not alternative. It's part of all the different things that you do for advice and health and stability and all those things. Everybody has a role to play.
Right. I remember there was a time where I had stopped seeing you for a while, just whether I moved further out of the city, and so I hadn't come by you for a while. And I remember actually having an injury, and I had all of the different tests and stuff. With my doctor sent me for a back exam and told me I had an old back. Gave me a bunch of different reasons why I was in this distress. And I remember I came to you, and it had been a while. It had been some years actually, and you had adjusted. And in that one adjustment, I noticed, like you said, a big change, because I had been dealing with it for months. It was actually over a summer. So yeah, sometimes you need to act on it, but you also got to know that it exists. I mean, I don't think everybody knows what the chiropractor can do for you. And
for sure,
mhm.
the population in Canada, it's maybe 5% of the population that regularly sees a chiropractor. 15% of the population has been in a chiropractic office, but there's only about 5% of people who regularly visit a chiropractor for anything, for an assessment, for an adjustment, for anything. And what that means is that there's 95% of the population is walking around out there thinking they know what a chiropractor can do for them, but having never been in an office, they don't really know. They just know what other people have told them. And any one patient really only knows what their chiropractor does for them. They
Mm,
don't know what I do for the other 6,999 people who come through the door.
okay. And that's he kind of brings me to this last question that I have is the how. I've noticed different things that you have done for me. I'd have a pain on my right hand side. You figure out which vertebrae it was, and somehow you do this. So, like, can you explain how you go about assessing and things like that?
I,
Yeah.
I think the most important thing with patient assessment is to listen to what the patient has to say about what's bothering them, and then be thoughtful enough to ignore that when you're assessing what to do. So you know what is bugging the patient, and then you assess what's going on with the patient and find out if anything that you assess with them is related to their problem.
Mm,
Because if you just go looking, like if your right low back hurts and you just go looking at the right low back as, well, that's where the pain is, that's where the problem is, it's almost never like that. It's
right.
more commonly that people get a problem that's painful because their body's adapting to some other thing going on that's not hurting them at all. And you know from your own personal experience that, you know, it's fine and dandy. Oh, why are you adjusting me on the left? I'm sore over here, right? And it's because very often with patients, the thing that's causing their inability to get better isn't the thing that hurts. It's something else. So the big thing with assessment is to listen carefully to the patient and then be able to examine, free of any expectation that where their pain is actually where you're going to end up treating them.
All right. Well, I just want to let people know that Dr. Pat can be reached at where? docwellness.com,
Yep.
correct?
Yep.
And right now the office is there in Mississauga on Dundas Street. So we'll put that
Yep.
information out there for them. And of course,
Okay.
the office number is 905-820-4620, right?
Correct.
Okay. So the question again is, in closing, what else do you do for fun?
Well, for 45 years on Friday and Saturday nights, I've been playing guitar and singing and entertaining in bars. And since COVID hit, I've been Saturday nights, I've been streaming live on Facebook for 3 to 3.5 hours, playing and singing songs from anywhere from 1929 to 2019.
Well, that is a wide variety. And you've been doing this, you said, for how long?
Since June 7th, 1975 was the first gig I had in a bar.
Wow. And it was always solo, like just going in and
Mostly, I would say 97% of the time, it's just me and my guitar, you know, as a folkie back in the early going, and now I use tracks that I construct at home in the studio that I'm actually sitting in right now, you know, where I record all the instruments and then play and sing against them when I'm performing so that people can dance and there's just a fuller sound. So that's my hobby.
that's your hobby. And that, so I guess this is one of the ways that you got you through your schooling as well, huh?
Right. It allowed me to finish university and chiropractic college debt free because I was able to work at nights. And just the only thing I lost out on was sleep. But you know, when you're 22 to 28 years old, there's lots of time later in your life to sleep, which would be now.
All right. Well, folks, that is Dr. Pat Hewitt. As I said before, you can reach him at www.docwellness.com. And for his fun side, you can reach him at sociable.com. I believe that's where it is, sociable.com.
That's
And
correct.
you can join in on and see him performing on Saturday nights now, anywhere around
Facebook.
8:30 on Facebook.
8:30. Yep.
8:30. Okay, around 8:30. And these gigs go somewhere anywhere from 2 hours to 3 hours.
They're always more than 2 hours and sometimes as much as 4, but they're usually 3 to 3.5.
All right. So thank you again for coming and sharing with Senior Living 411. And if anybody's looking for a good chiropractor in the area of Mississauga, Dr. Pat is your man. Thank you again for joining us, and
Thanks for having me.
No problem at all. It was great seeing you again and chatting with you.
Thank you. Bye.
Bye now. Join us for our next show with Desiree King and Keisha Johnson, the president of A Supreme Foundation, as they discuss the 411 on excellence in senior care.